Well, hello, good evening, and welcome to Be Buckfastleigh's second Question Time Live. We are delighted to be bringing you another opportunity to hear news from our community, and of course, a chance to put questions and give your opinions to our panel tonight. So if you're watching live on Facebook and want to contribute, please type your question in the comment section just below here, and we will try and put them to the panel. And don't forget to hashtag us on social media on BBQT on Facebook, Twitter and Instagram. So our panel tonight, we're delighted to welcome Suzy Williamson. Suzy's the coordinator of Buckfastleigh Community Care, a small local charity which works closely with Sharing Buckfastleigh. They work with older people and people living with long-term illness, providing wellbeing services, befriending and social groups. Suzy leads the team making the check-in and chat calls for the Buckfastleigh response team. Welcome, Suzy. And we also welcome tonight Andy Stokes. Andy is an ex-teacher in further and higher education. Andy moved to Devon from London in 1994 and has lived in Buckfastleigh for the past 14 years, where he's earned his living as a freelance doing what he calls computer stuff. He's also a qualified counsellor of the psychological kind. And as a volunteer, he's organised many activities and events in the town over the years and was elected to the town council in 2015 and has been chair of the town council and has been mayor for the last 2 years. Buckfastleigh GP Dr. Ian Hodgins joins us again tonight. Ian has been a GP at the town's medical centre for the past 12 years. His most recent role in the GP surgery is the COVID-19 lead. He's an honorary fellow at Plymouth University Medical School, giving regular lectures on a variety of subjects, including management of outbreaks of infectious diseases, and he takes a keen interest in local history. And lastly, Rev Laura McAdam. Laura was a regional coordinator for an international development charity for a decade, managing volunteers, events and fundraising across Devon before training for ordination and pitching up in Buckfastleigh last year. She's the curate working with Reverend Tom Benson at St Luke's Church. And as part of the local response team, she's taken on the coordination of all the volunteers and is the one who makes all those amazing flowcharts that you've seen. So welcome everybody tonight. We should have a lively one. There's a lot to discuss. So I'm going to kick off tonight with the first question, which revolves around the response team. Many of you will have noticed that the naming has changed. There's been a rebranding. It was Buckfastleigh COVID Emergency Response Team. It is now Buckfastleigh Response. And Andy, I wondered if you could explain what the reason was for that name change.
Thanks, Amanda. Yeah, well, it kind of feels like we've got a bit of a breather at the moment, doesn't it? There's a bit of space. We're not convinced that this is the end of the crisis by any means, and we're expecting possible further waves of the epidemic. But we're also aware that there's a lot of economic impacts that people are suffering from because of the crisis, and they're likely to go on as well. So it doesn't feel like an emergency right now, but we're still responding. So, and I'd also like to see, and I'm sure other members of the community and people here also will agree, that what we've managed to gain during this is an incredible community response that supports lots of people within the community that need support, and we should carry on doing that beyond the emergency. So it's a renaming just to indicate that we're not all about emergency response and that we're here for the duration, really.
On the question of that range of response, Laura, I wonder if you could tell us a little bit about the incredible range of things that have been provided to the community, not just food and picking and shopping, but an incredible range of things.
Absolutely, and one of the reasons we wanted to change the name was to really emphasise that those things that we've put in place will be continuing, whether you're in a state of immediate need or whether you're looking forward to your next paycheck or lack of. We can still provide those things that include food, any kind of food. We get loads of wonderful donations of fresh food in from various really generous businesses. Prescription pickup is something we put in immediately to help those who are shielding, unwell, elderly particularly, to have someone just to go and do that job for them. And we want to keep that going as far into the future as we can. It's a really helpful service, and one our volunteers really love offering. They get to meet people and have conversations at a long distance away, shouted conversations with people who maybe haven't had any human interaction for a couple of days. We also have some well-being activities. We provide craft packs to families from St Luke's Church, but provided for us by Hello Summer and various initiatives. We have a book bank, because actually with the library being closed, we don't really want people buying lots of books from the internet, when actually our charity shops had stocks of books. So we bought them up with the help of the Rotary Club and the council and the church and the Mothers Union, and we just give them away for free. And so we're continuing with initiatives like that, which help not just the immediate need, but long into the future, people's well-being, as well as, and I know Suzy's going to mention it, a friendship scheme, check-in and chats, actually someone just to give you a call and see if you're okay. So it's a really broad range of things the response has picked up on, guided by the need in the community and by our volunteers. We've collaborated and come up with, I think, something really special.
Can I just ask you about confidentiality? Because I know some people are concerned about whether or not their names and their addresses are going to be widely known. So one of the first things we did as we raced into lockdown was put some really robust procedures in place. And amongst this Zoom table, as well as amongst the volunteers, there's lots of experience in putting safeguarding activities and making sure confidentiality was really key. One of the principles of the food bank that has spread out throughout all we do is that dignity is really important, and people have a right to privacy and a right to be treated in the way they feel like they should be. And we believe that's really important. So we have some good technology. IT geeks, led by Andy, have put in some wonderful databases, which means that information is kept really safely. All our volunteers sign a confidentiality agreement. And so you can be sure that when you talk to us, your details are kept within a very small team. And once this is all over, we'll just meet in the park and meet for the first time if that's how you want it. But we've been putting some really sturdy procedures to make sure that people's details are kept safe. Brilliant. Thanks for clarifying that. And then Suzy, can you tell us a little bit about the friendship schemes and more on the welfare side of things? What's happening? Unmute yourself, Suzy, because I think we can't hear you.
Sorry about that. We've had a befriending scheme in town for some years, and it's obviously been based on people visiting for a cup of tea and dropping in. So we've gone massive now. There are 70 people in Buckfastleigh and the surrounding villages receiving a phone call at least once a week. There are some people who get a call twice a day because they're really isolated and they're a little bit confused perhaps. And so we're making sure that they stay safe and they don't go outside their home looking for social contact, which is not safe, but they're not necessarily understanding. And some other people, you know, they're just really bored and they just need someone to speak to, and other people quite anxious and would like to know that somebody, you know, is there for them, and that's all in confidence. And the team is just fantastic of our volunteers. But we realise that one-to-one isn't always enough. You know, it's nice to have a call from somebody, but it's nice to do things. You know, people are missing going to pensioners groups or lunch clubs. So I'm really excited that we have actually got a whole range of things that people can do now. Monday mornings on the phone, you can dial in and do the crossword with Jenny. She sounds just like Jenny Murray from Radio 4. She's a lovely lady, and it's not too hard, but not too easy. It's just right. Everything's for 45 minutes on the phone. We do reminiscence memory Tuesdays on Tuesday. We had a lovely time this week talking about days out in Devon. Wednesday, a relaxation moment and having some well-being where you're just visualizing and doing some lovely breath work, and then a quiz tomorrow morning, a hard one in the morning, and in the afternoon we'll do an easier one, and bingo on Friday afternoon, and singing last week. It's sort of thing you don't expect to be able to do on the phone from your home without the internet, but we've been working really hard and it's working fantastically.
And is this the kind of thing that you think might be very useful to continue after the worst of the crisis is over.
Absolutely. I feel a bit annoyed with myself that I didn't ever think about doing this before COVID hit us, because I've been working with people for a long time who are stuck at home, and their mobility or physical health meant they couldn't come out regardless. So lockdown is nothing new for them. This way we're able to reach people and bring them together. So there's going to be this fantastic legacy.
I think we'll be talking a little bit later on about all the amazing things that have actually come out of this pandemic and how the community has pulled together in the most amazing way. But we'll come to that in a little bit. I just wanted to move on to the next question, which was sent to us from Pip. And she writes, this is for you, Suzy. She says, it's National Carers Week. As a community, are we aware of any young carers, either from before the lockdown or as a result of changing family circumstances? How could young carers be supported in our community?
Great. It's a great question. So the first thing to say is that no, we haven't had, as far as I'm aware, any young carers come towards us yet. None have made themselves known, and nobody has asked us to contact any. But if they're listening, or anybody knows of anybody out there, please do call the helpline. When you do that, we can signpost you to Young Carers Devon. It's a dedicated organisation. They will support with helping that person manage, what they're having to go through, set goals in their lives if they need further support, just to get their own mojo back, because it can be very easy to become lost in caring for somebody else and stop thinking about your own needs and priorities. And yeah, they're making sure that those young people are connected. So the service is out there and available for use.
And just to remind people what the helpline number is, I'll say it now, and we'll also post it in the comments below. It's 01364 255 819 255 819. Andy.
Yeah, I just wanted to add to what Suzy said, that if anybody is caring for somebody and they're isolated and they would like support, then please encourage them to ring the helpline number. They can sign on to be called as part of the check-in and chat team, and just get some connection that way, which makes a big difference. Absolutely.
And we're getting some comments coming in. Sammy Reese says everyone's doing amazing stuff and lots of positives to continue in the future, says Emma Blackmore. So everyone's feeling the warm fuzzies about the good things that are going on, which is great. Question from Jane Elliott, and this is directed at you, Ian, Dr. Ian. This is about this is the maths lesson now, the R rate.
I love it.
Now, the R rate, we know that the R means reproduction number and is a way of rating the disease's ability to spread, right? Yeah. So this is her question. According to Cambridge University, the Southwest has one of the highest R rates. Now, she understands what the R rate is, but can't find any information on how it's calculated. Can anyone answer this? In words of one syllable, please, for those of us who aren't very good with numbers.
Okay, I'll try to. Let's go back. So R is the average number of people that get infected by a single infected person. Okay, now when this started, coronavirus had an R rate of about 3, meaning that if, say, Jimmy down the road caught it, then he'd pass it on to 3 people, who would pass it on to 9 people, 27, then 81, and then more than my maths can cope with. Okay, so 3 times each time. Thanks to lockdown, the R rate has managed to get below 1. So the number of people having it actually slowly goes down, and would go down to 0. So we would get to the New Zealand state of not having anyone infected. Now, R rate is, in effect, it's a mathematical calculation that used to be, that was done looking back over the last fortnight. The problem with COVID is that it takes 2 to 14 days to actually get the infection. And so therefore the people getting it in, the people that we know have got infected a few weeks ago. So our rate does, it is behind the times. And it is, in effect, it's the increase in number of new cases, which increases over time.
And
I
where
don't
is
think I
the
explained it very
southwest?
well then, but fine.
Where is the southwest currently? Because I thought a few days ago we were below, the country was below 1 with the exception of us.
Yeah. So I think last week it was 1.01 and this week it's 1, which actually is very, very dangerous for us if the government decide to break the lockdown like they are doing. And in effect, what we've got to try and do is get back to the way we were distancing from each other 2 or 3 weeks ago. So I think that any of these new things or anything new thing that's come in over the last 2 weeks is going to be rather dangerous for us because it will push this R number above 1. And so therefore, actually, we'll get more and more and more infections. Now, at the rate, Devon and Cornwall are very low. We have a low rate of infection, but it won't take very much to actually get that up to actually being quite substantial. So I'm very worried.
Okay, important that we underline that. The seriousness of it is still there for us all down here.
Yeah, yes. And even though it is very, very annoying, I think we do need to take that into account and potentially not do the breaking of the lockdown that the government is suggesting. Okay,
we'll maybe talk about what that means in a little bit. Andy, were you asking to come in on that?
I don't have anything to add to what Ian's said there.
Okay, so you've actually answered one of my questions there, Ian, because it was about the lag. So what the numbers we're hearing now are actually about 2 to 3 weeks behind the real picture. Is that correct?
Yes, although it is changing slightly. So there's a new study done by the University of Cambridge, and I think it's the London School of Tropical Hygiene, which is in effect randomly selecting people and testing them and seeing whether they've got COVID or not. From doing that, they can actually be a little bit quicker than the past figures. So we're probably lagging by about a week. Maybe a week and a half, but yes, and it still looks very, very poor for us.
And we're getting some comments coming in that agree with you, Ian. We don't want to be too hasty, relaxing, they're saying. And also, this is off this topic slightly. It's more about help for patients who are suffering from mental health issues during this time. I think in our last question time, you said that you'd seen an increase in people who were showing some increase in those problems, that people were suffering more from mental health issues. Is that still something that's presenting, and are you able to suggest ways of helping?
Yeah, that is still happening. We're still getting more mental health issues than we used to have, and the advice is very much the same as it always has been. So exercise as much as you can within the limit of restrictions, eat well, and the depression and anxiety service, very good service that are now available. So they will discuss, they will talk to you, and the best thing to do with regards to that is just to Google them if you do want to have counselling and go into it. It's a self-referral thing. But if you're having problems, then by all means phone us up and we can point you that way or discuss things with you.
So come and see you at the medical centre in the first instance.
No, phone us up and we will discuss it with you over the phone.
We're
because of COVID, we're not seeing very many patients at all.
Okay, that's great. Suzy, what would you like to add to that?
Just wanted to let people know that the wellbeing service is available in town. I'm a wellbeing coordinator as part of the NHS initiative. It's a health and wellbeing programme, and we work with people for over a number of months and help them identify what really matters to them, which is, really important in a time of lockdown and of isolation. What is important, and when you get someone to help talk you through what's important with you, it can help you get out of that mind lock, which can be really unhelpful when you're spending a lot of time on your own. And then we work out steps of how you can achieve the sort of things that you want to have more of in your life at the moment. And it's totally free. You don't have to be referred by Ian, but you can talk about it with your doctor and they can refer to you. But you can also call the helpline and say that you would want to speak to a wellbeing officer, or whatever they want to call it, wellbeing coordinator, and I can go through that with them and see whether it's suitable for them.
So there is help out there, and people don't have to suffer in silence on their own. There are people that they can talk to. Mark Jeffrey has also written suggesting that spending time in nature is also great for your mental health, which Ian has just underlined and everybody is agreeing with hugely. And we're so blessed around here to have such beautiful places to walk and visit. Ian, could you remind us on what we should be doing and not lapsing on at the moment in order to keep safe?
Okay, so it's the same thing as before. There are three things. One is washing your hands regularly. Wash your hands for 20 seconds. And I love this because yeah, and this goes on longer. So wash your hands for 20 seconds. That's happy birthday twice, or the Lord's Prayer, or God Save the Queen, both bits of it. And that's the standard version, not the Sex Pistols version. Okay, so that's one. Two is social distancing. So you've got to be 2 meters away. You've got to be 2 meters away from people. And that includes shops, which is difficult. And it's particularly difficult, as I found, if you go near to the jam department and someone is sitting in front of the jam, and you've got to hang around the marmalades until they go, and then you can get your jam. So basically, don't be afraid to just take more time while shopping, okay? And the third thing, and one of the most important things, is that if you have any symptoms, and this can be very, very minor symptoms, then you have to self-isolate for a week, and your whole family has to self-isolate for 2 weeks, okay? And that is independent. So even if you feel better the next day, you've still got to take the week off, okay? And that people are finding quite difficult at this time, is to actually take that time off, but you must do it. You mustn't go back into the community with coronavirus.
And the temptation I'm imagining is that with businesses opening and people being required to work and seeking work, the pressure is there to want to do that, but we must still be very vigilant.
Absolutely. You must not go back to work unless you have a week off. Now, there is another issue, and that issue is with regards to swabbing. Now, the problem is that swabs sometimes give a false reassurance. And yes, if you don't have very many symptoms and you have a swab and it's negative, then potentially, yes, you could go back to work. But if you have symptoms of coronavirus, even if the swab is negative, then you should stay off for the week and your family should stay off for 2 weeks. You've got to assume that that false negative is wrong.
How would people go about getting a test if they felt they were showing symptoms?
You either phone 111 or you go online and you just Google in, how can I get a coronavirus test? And it's very easy. It's a government website, and they will tell you how to get the coronavirus test.
Thank you for that, Ian. The government website, I will be giving you the website address at the end of the programme just to remind you where to look for the latest government information. Andy, I'd like to move on to you now. We've just had a government announcement at 5 o'clock. The latest guidelines have come out. Could you run us through the latest issues around socialising and meeting up with other people?
Yeah, I just wanted to add to what Ian was saying there. My understanding is that 30% of the home testing kits give a false negative or thereabouts.
Yeah. Any 30% of any test, apart from the antibody test, will give a or anyone that tests positive. Anyone that tests negative, again, 30% of those will actually have coronavirus. Yeah.
So the positive tests are usually right, but the negative tests are not that reliable. And the government is saying that if you get a negative test, you can go back to work. Well, that's a gamble, if you ask me. Anyway, so yeah, so the guidelines are changing every week, and again, there's been some changes today. So I've taken some notes because I'm never quite sure where we are. I'm sure everybody's struggling with it a bit.
Yeah, it's confusing, isn't it? But let's talk a little bit about this idea about support bubbles.
Oh yeah, so well, just to say initially that currently the rest of it still stands, that the general, if you remember the general public, you don't have an underlying health issue, then you can meet outdoors with up to 6 people, including those from other households, but with social distancing and with hand washing if you're going to be going through their house to use the bathroom if you need to, and don't share equipment or plates or cups, etc. and you can go to work if you can't work from home and your business is not, your workplace is not closed, with social distancing, and it's down to employers to try and implement the guidelines that the government's giving them for how that is managed within the workplace, which is obviously very challenging. And the new bit is that we're advised to wear a mask if we're in a place where we're in close contact, where we can't keep social distancing up, like on public transport or in shops. And that I think on the 15th or the 18th of June, that will become a requirement, a legal requirement on buses and public transport, that you have to wear a mask. And we're going to talk about masks later, I think, so I won't go into that at this point. You're not allowed to go indoors with people you don't live with unless you have to for work. You can't stay away from home overnight, except if you're doing it for work or funerals or for your safety, if there's an emergency. But if you're over 70 or have pre-existing health conditions, or you're pregnant, then you need to continue to take care, particularly to minimize outside contact, just as you probably have been doing. And if you're already identified as extremely vulnerable, you need to continue shielding, as you've been doing, no doubt. The new bit today is the support that affects people is the support bubbles, which is that a person that's living alone can visit and stay with one other household, which means that if you're a person in a relationship with somebody else but haven't been able to see them, spend time with them before, you can go and stay with them now. If you're a family member living on their own that wants to be with a family, then you can do that. That's the new bit, isn't it? Schools are now not fully going back till September. The government's plan to get children to schools earlier has not worked out. People have voted with their feet, I think.
Thank you for that, Andy. Yeah, it's complicated. I think we can all agree on that. If you want to check the exact advice, then it's www.gov.uk/coronavirus. We've got some comments coming in from the Facebook chat. Louise Trewern has picked up on that point about maintaining social distancing, and she's saying that there's some concern around many people are not distancing and coming close to each other in the supermarkets now. And Michael Brown says that he often sees a lot of staff in shops, so people are clearly feeling concerned about how the rules are being interpreted. And moving on to a comment from Melanie Thoddy, I hope I've pronounced your name right. She would like to say a big thank you for the work you do, which has allowed us to keep our dad safe. You are marvellous. So let's talk about extremely vulnerable and shielding people, Laura. So extremely vulnerable and shielding people have been advised they can go outdoors, but not to shops or crowded places, at least until the 30th of June. But can people still get their prescriptions, their hearing aids, their batteries, and are their transport needs and supplies still being met?
Absolutely. What we really want to emphasise is that we are here for the long haul, and that while some people are returning to a sense of new normal, or going back to work or becoming social again, actually an awful lot of people might well feel they're being left behind and going back into the shadows. People who maybe were there before lockdown probably are now feeling they're going to be invisible again, and we cannot let that happen. So for anyone who is vulnerable because of the pandemic or was before, we want to continue to support you. So for as long as you need us, we can get your prescriptions for you. We can send you food, whether you usually are the kind of person who's ever used a food bank of any kind. It is open to everyone for whatever reason. And we can also help you out with some of the incidental issues. Tom and I have got quite good at troubleshooting. People call us up just to talk through those kinds of strange issues. And there's a whole team of people and lists of local tradespeople who can help you. Don't be alone in anything that might come up. We are here to stand with you in whatever is happening, even if it is just for a chat. please call us.
Do you need the internet to access this service?
Absolutely not. Between us all, smoke signals, shouting over fences, we will get help to you some way. Absolutely. You can just call, as long as you've got a phone or someone with a phone, or can shout really loudly, the message will get to us that you need us to be in touch with you. So call the helpline. That is the centre of all activity, and we will cascade your needs to whichever expert is on hand to work with you to get you whatever you need to stay safe and stay healthy. It can feel like things are going back to normal, and we're all putting a nice sunshine on how lovely the community is working together, and that is brilliant. But it is still a very serious situation. So please don't take unnecessary risks when I've got loads of volunteers who are desperate to work with you to keep you safe.
And Suzy, you wanted to contribute something there.
Yeah, I just wanted, well, I think what Laura just said about feeling left behind. I think this social bubble, when Boris Johnson said today, it specifically doesn't include the shielding people. I can imagine a lot of people's, expectations going up and then feeling their hopes dashed. So that, yeah, there's going to be a lot of that. And even those people who are thinking that they would like to go into, that they're eligible, they have to think really carefully, don't they, about whether or not they, is the household they would like to merge with a safe one for them, having done so much work to keep themselves safe in the first place. But what I wanted to say in terms of, what else is there if you are shielding and vulnerable, obviously getting to medical appointments has been a real concern for some people. And Ashley, the Black London cab, is available for people in Buckfastleigh. Don't forget that. It's taken a pregnant lady to Exeter to have a scan. It's taken people with broken legs to Newton Abbot. It's taken people just up the road to their appointment at the surgery. And it's free. We're happy to take a donation for petrol, but it is there. So especially at a time when sharing Buckfastleigh and the lovely Mary and Barry used to trundle everybody around town, 24/7 virtually. Obviously they're not able to do that anymore. I want you to know that they got PPE for the taxi. So they've got masks. You'll be invited to wear one too. Your driver will wear one. The glass partition between you and the driver is taped up to make, and they have the windows open at the back. So they've done everything they can, and it's cleaned down with chlorine using the same protocols as the fire brigade use when they clean the engines down. So we've done everything we can to keep you safe. So
if someone wants to use that service, how do they find Ashley?
Call the helpline. It's the answer to everything.
01364 255 819 255 819. So you've just answered the question, Suzy. Sammy Reese says she lives alone and her daughter and young granddaughter have been isolated. So they're in her safe bubble and she can finally see them, but she doesn't want to take public transport and she wondered how she was going to do that. So you've just answered that question. Ian, did you want to pitch in?
Yeah, no, I just wanted to say that, Laura, this is for everyone, isn't it? This isn't just for the shielded. No. And my advice would be for those people who have the health problems or are over 70 or over 80, is that actually you should take this up and you mustn't get coronavirus. And the easiest way of doing that is to try and distance yourself. And that's not happening very much in the supermarket. I mean, you could probably get away with it, but you don't want to probably get away with it. You want to be safe. So use Laura. She's amazing.
Can I just ask about if people do feel that they want to take public transport because Ashley won't take them where they want to go, should they? I mean, if, for example, if they want to go to Plymouth, should they take public transport?
I think generally we're still only advocating essential journeys. So if you need to get to work, going on a day trip via public transport, I think would be a little unwise. Ian?
Absolutely. I mean, all of these things, you have to weigh the risks up, and the risks of going on public transport are reasonably high. Particularly because you'll be on the transport for half an hour or even more from Buckfastleigh. So actually, I would certainly advise that you don't go anywhere near public transport, but it's up to you and it's up to the risk that you want to take. but coronavirus is a horrid virus, and I think I would try and keep the risk as low as you possibly can.
Andy, can I bring you in on this one?
Yeah, I'm sure, you know, all of us are feeling the results of being constricted for such a long time, and there's a real tendency as the government starts to remove restrictions for us all to go, thank God that's over, let's get out there and get back to some kind of semblance of normal life. But the reality is that nothing has fundamentally changed. We've been lucky, especially here. Sorry, Ian, you were going to say something. Do you want to say it now? Or
Oh, no, carry on. I'll say it at the end.
So, you know, we still have a disease that is very infectious, that is deadly, that we have no treatment for, that we have no vaccine for, and we may not have for some time to come, although there are tremendous efforts going on to produce something. When lockdown started on the 23rd of March, there were 103 deaths. There were 200 yesterday. You know, we are not in a better position. The curve is going down rather than up, but it can turn around and go up just as quickly as it did in the first place. So I certainly will be taking government advice with a pinch of salt, a very large pinch of salt, and continuing to be extremely cautious about how much I'm in social contact with other people. I'm fortunate in that I work from home anyway, and I realise that lots of people are going to be under enormous pressure to be in more contact with people, and it's going to be much more difficult for them. But wherever possible, I think we need to continue to try and stay as strict in our social distancing and hand washing and all the other things that Ian's mentioned.
So generally, just putting this to the whole panel, do you all feel that the easing of the lockdown has happened too quickly?
I think that actually it hasn't happened too quickly, but it's happened too soon. I think that with the 200 people dying from coronavirus, we should have left it another 4 or 5 weeks, probably. And I think that the difficulty is that virtually every other European country has been able to get the rates of infection and the rates of death down to virtually zero. We haven't been able to do that for some reason. It might be going on the beach or displays or whatever. But I think until we actually get to that level, we shouldn't break lockdown, because the thing about breaking lockdown is that what you're trying to do is you're trying to get the R number up to 1 so that you carry on with the same number of coronavirus patients and you carry on with the same number of deaths. But I think that actually having 200 deaths a day is far too much to carry on with. And we should have brought it down. We should have brought it down an awful lot further before actually lockdown was broken.
Andy?
Yeah, I'm afraid, you know, I want to pick up on what Ian said there. I think it's unfair to blame individuals for going to the beach or whatever. I think our government, unfortunately, has a shocking record in this crisis. We're up there with the top countries in the world in terms of mortality rates. You know, we shared the top. We're in the top place for a week or more until Sweden, who've had no lockdown, and Brazil, whose leader famously said it's none of our business, took over that place. So it's really, you know, if we'd followed the example of Germany, for instance, lockdown a week earlier when there were 80 odd deaths instead of 300 odd, we'd had continued testing at a high level and tracking and tracing, and we'd had a health service that was fit for, you know, it wasn't already strained at the seams before this. We might have seen levels of mortality around 8,000 instead of 60,000. And it's really, I mean, I'm absolutely furious about it, and I'm sure lots of other people are too. Yeah, I don't know what else to say, sorry.
That's okay. Ian, I think you wanted to pitch back.
I think you probably can blame the people on the beach as well. They're not obeying the rules. You have to blame them too.
On the question of what, sorry, Suzy, yes, I was going to move on, but
I wanted to just say very quickly that Patrick Balance was saying today that, you know, a key part of easing the lockdown and everything we're seeing is going to be an effective track and trace. And it does feel like the government is saying that they're putting it in place, but we know that it's not actually ready to go yet. And therefore, I think that's just another concern that we can, you know, we need to be, you know, reading between the lines of what we're hearing at the moment when we make our decisions about easing the lockdown for ourselves.
Yes, Andy.
Just to add one tiny thing is that I will obviously come under criticism for that, and I'll be as being a political issue. I just want to make it clear that I would be furious with any government right now that performed so badly and where so many people have died. You know, this to me is not a political issue. It's about the sanctity of human life and putting human life over economic gain, and that's where the failure's been, I think.
And it's not just you saying that, Andy. Professor Neil Ferguson came out this afternoon saying that we locked down a full week later than we should have done, and that the number of deaths could have been halved.
It's too little, too late, and it's likely to be too much, too early, I think.
Can I talk specifics now about what we could practically do to protect ourselves? We're getting questions referring back to how we're handling ourselves in public spaces. And Sefton Payne has been agreeing that the easing has maybe occurred too soon, and is obviously concerned about how we operate in our shops. And he would like Dr. Hodgins to advise how he thinks retailers should be operating. What are the safest measures for staff and customers? And I think we could tie that in also with the question about wearing masks and gloves, which is a contentious issue, and I'd really like some clear advice on that.
I think people in the shops and the shop owners have to do exactly have to follow the rules. So everyone that works in the shop has to be distanced 2 meters if that's possible, and potentially actually stay outside of their shops, outside of the actual shop front, if distancing is a problem. Everyone in the shop should be able to self-distance. And I think actually we should try and get shops which actually have, which I think the Co-op down the road does have, which is actually just a one-way system through the shop. It can be very annoying occasionally, particularly with the jam department and the marmalade, but you have to just wait, and you have to be prepared to actually just stay there for even a few minutes before the other person moves ahead, rather than barging past them and grabbing the jam. Now, face masks are interesting. Actually, there's wonderful chap. Someone actually donated face masks. A chap called Peter de Groot has made us face masks for everyone in our family at the health centre, and thank you, Peter, for that. That's absolutely fantastic. My daughter made me one a couple of weeks ago, and I haven't got it on me. I'll go and get it before the end of the performance. But about face masks, and I talked about this last time, and yes, by all means, wear one, and it is vaguely useful, but don't rely on it. You mustn't. You must self-distance. The problem with face masks, particularly face masks which are made from cloth, is that actually the pore size is far too big. So therefore the coronavirus will just go through it. They do stop a little bit, but not particularly very much. The other issue with regards to gloves, I think absolutely pointless. Slightly, well, you have to wash your hands before putting gloves on. And they only last for a matter of a few seconds until you start touching things. And the thing with regards to the gloves that we use in surgery is that we don't put them on until the patient is actually in the room, okay? And the patient is the first thing that we touch. But the problem is, if you're going shopping with gloves, then you're touching everything everywhere. So gloves, I think, are absolutely pointless, and they're more difficult to wash than hands. So I wouldn't go with gloves. Yes, face masks are a bit useful, but you have to be aware of the potential problems, the potential limitations of them. Has that answered your question? I think it has.
Could we just emphasize, though, if you're not wearing gloves, you must wash your hands?
Yes, absolutely.
Andy?
And again, 20 seconds, and I won't go through that up again.
Just to say that there are World Health Organization guidelines on the web about how to what kind of masks you should be wearing, how to put them on, take them off, put them in a plastic bag when you take them off, don't touch the mouth area. They actually recommend a 3-layer mask with a water-resistant outer layer. On the government website, it shows you how to make one out of a t-shirt, but we don't know what the efficacy of that mask is going to be. whether it's going to be much use, as Ian says, or not, we don't know. But one thing that's kind of important is if you're legally obliged to wear them on public transport, and if the government's advising you to wear them and you go around without one on, then you're likely to become possibly subject to criminal prosecution, but at least getting the anger and ire of people that are wearing them. And there's a kind of symbolic value there as well, because it kind of says to people, I am respectful of your well-being by wearing this mask. Whether or not it's going to be effective in that, we don't know, I guess.
So moving on from the mask question, Andy, thank you for pointing that bit out. I'm just going to throw one question at Ian before moving on. We've got a lot of comments coming through, and it'd be great if we could rattle through some of these. It was really going back to the mental health issues, and someone called Happy Potter has written in, who was talking about access to counselling and saying that there's a 6-month waiting list, and you know, what should those people who really need counselling do in that situation?
I think the Depression and Anxiety Service, if I remember right, hasn't got that waiting list. There are various avenues of getting counselling, and I think our counselling service within the surgery has in effect finished for the time being, and therefore we're passing people on to the Depression and Anxiety. So the phone the Depression and Anxiety Service, and obviously as well as that, do all the other things that are associated with good mental health, like exercising and eating well and trying to sleep well. So I think the Depression and Anxiety Service is certainly the right people. And if you have problems, if you don't get that, then just phone us up and we'll see what we can do. Okay,
thank you very much. We're having a question now from Lisa Scott. Do the panel feel that the Buckfastleigh response services are being advertised well enough? She says it's amazing listening to this and what's on offer, but she's pretty sure there's a lot of people in the community who could benefit from it, who probably don't know anything about it. And she also sends respect for the people who are offering their time and service for the community. Who would like to answer on this one?
I mean, quickly from the medical centre, people that are requesting repeat prescriptions, I think most of them are being told about the service, about how to get the prescription from the chemist if they're self-isolating.
Absolutely. Everyone who has received food, called the helpline, we encourage to spread the word. There are posters up all around town, and brand new ones have gone up this week, kind of big A3 ones with the new branding on. So hopefully that will catch people's eye, those who are out and about. But for obviously the most vulnerable people, hopefully aren't coming to town. So we do rely on the public and our community to share the word. If you've got a neighbour you're worried about, please, write down on a piece of paper the helpline number, and then post it through the door once you've washed your hands, and then wash your hands again. But we do rely on neighbours. That fundamentally, that's what's made this work, is us looking after each other. So if we continue to get the word out, obviously social media reaches only so many people, papers, radio, we're doing the best we can, but ultimately we all need to kind of collaborate in making sure everyone is looked after.
So if you know somebody who could benefit, who doesn't know about the service, please let them know.
Let them know. Give them the number. Yeah.
Yeah. Suzy.
Yeah, and I just wanted to say that we're doing our best also to work through the existing networks. And while we've been trialing these activities this last fortnight, we're now just ready to really start rolling them out and let as many people know as possible. So this is like, almost like launch day for Buckfastleigh, really. But we will be working, going through the Monday Club and, contacting Barn Park Residents Association and people like that, so that we can spread those words, by word of mouth, because we do realise that Facebook, and as you say, Laura, if they're not coming into town, it's very limited. And Andy has something else to add.
Yes, Andy.
Well, just that, we've had, I think, 3 town-wide leaflet drops over the last 3 months, 12 weeks. Yeah. It's been in the local papers a couple of times, 2 or 3 times. It's been plastered all over the town in posters, as Laura said. It's been on social media. I don't know what else we can do, really. We just keep plugging away and try and publicise it in whatever ways we can.
Have we ruled out a blimp?
Or smoke trails.
Smoke trails. There are creative options, but so if anyone's got any ideas, we'll listen.
I'm not sure that the town council budget would meet that demand, though.
Crowdfunder. We'll talk later. But yes, we need people to spread the word.
Blackmore is pitching in again, say you've all done a wonderful job. So a much appreciation going on for you all. Now I'm going to turn to a question that we received earlier in the week from Paul Roberts. He says, do you think we'll see any live events on the streets of Buckfastleigh in our town this year? For example, the Christmas fair. Who shall I
take that?
Yeah, why don't you take that, Andy?
It's really hard to say, isn't it? I mean, the possibility of outdoor events looks like it's there at some point, with reasonable distancing. Whether or not anyone can predict where we're going to be at Christmas, I don't know. The town council is taking the view that we're not going to open the town hall until we feel like we're not putting the staff and residents at risk. So we're taking a very cautious view, and I guess most other groups and organisations will be doing the same.
And we might have to think about doing things differently and creatively in the future.
I wish I could give an answer, but you know, who knows?
I think there are lots of opportunities to still have those markers and those community events, but as you say, Amanda, in new and creative ways, which I think we've got really good at in the last few months as a nation, thinking about how we can celebrate things, and it'll be a moment in history for us. I know for the church, we just as a marker, we don't have any weddings booked that will have more than 15 people in the congregation up until Christmas. Most people have postponed beyond Christmas, if that gives you an idea of how the wider network's working. But we are looking, and it's Tom's idea, unless it works, in which case it's mine. But we're going to look at doing a church service, because many of our congregations just haven't seen each other and would like to worship together. We're going to meet in a field, get everyone to come in their cars, and we'll just blast the service so they can be socially distanced, and we can make sure they're parked a long way away. Maybe if it's sunny, they could get out of their cars, and it could be a complete disaster, but it'll be funny. And it will be a memory and a chance to try out something creative that still gives us a feeling of moving forward, rather than being stuck in this kind of static, isolated place. So I think there is a place to grieve. Like, that is important to say this is hard and it's sad, and lots of the things that we'll be missing this year are difficult. But there are also opportunities to do things that we'd never have thought of, and ways to connect with each other. And we can say, where were you when there was that disastrous Songs of Praise type service that the church tried to do? So yeah, I think we'd love everyone's ideas about how as a community we could replace community events like the Christmas fair and all sorts of other things in ways that are really quite unique, and use the skills and talents of this community.
You've really sold it there, Laura.
Bye.
I think we all really want to go to see what that would be like.
Now,
it must not be forgotten, of course, that this Saturday is the Swift celebration in 4 Street. So if you walk past the living room between 5 and 8 p.m, there's going to be a walk past installation, a piece of projection art. And there are Swift craft packs that are available outside St Luke's Church and outside the living room right now. So a video and sound installation on Saturday past the living room in 4 Street. Laura?
The Swift packs, I've nearly run out outside of St Luke's Church. So first one there in the morning wins for the last 2.
Fantastic. So we're going to start to wrap up and come towards the end of this question time, but I just wanted to put to the panel, the expression that so many people have been sending us, that what we as a community have achieved is absolutely amazing. And I just want to put to you all, what you would like to see continuing going forward. And also what kind of thanks you want to express to those people who've given their time and effort and, just their love and attention to everybody else in the community. So I'm throwing that one open to everyone. Suzy.
Yeah, well, I'd just like to really acknowledge the massive contribution that the check-in and chat volunteers are making. It's not easy being there for people who are feeling very isolated and down. And they are they're demonstrating such care and attention for those people and making sure that they're keeping their confidentiality, keeping them very close. And I know, you know, they're constantly working out what can I do to make those people's lives better, you know, and I have to keep saying, you know, just by being there on the phone and listening, but I know it's not easy. So I just want to say an enormous thank you to those people and the people on the welfare helpline. So every morning between 9 and 12 there are volunteers manning the phone, so if any welfare questions come through, any well-being things, there's somebody there to answer and have a conversation in the moment, which is just an extraordinary contribution. And I'd like to, I really know that many of the people are getting so much out of making those calls, and the need will continue. So I do know that this check-in and chat service is going to be something that lasts.
Yeah.
I think that, I think the community response is absolutely fantastic. And I don't know any other town or village which actually has a similar sort of thing happening. And I think probably in a few years' time, we'll think, yeah, Buckfastleigh, we really, really did it then, didn't we? That was brilliant. And I think we are brilliant. And I'll repeat what I said last time, which is actually this brilliance is keeping people at home and is saving lives, probably more lives than we're saving in the health centre. So I think absolutely brilliant. I love it. And I love this as well. This is good, isn't it?
It's fun.
Yeah.
You get a chance to see your jazzy shirts, Ian.
Thank
we should
you.
keep them
Thank
just
you.
for that.
This is my home shirt, by the way. Don't wear this at work.
Laura, did you want to add to that?
I do. I mean, people don't often realise the scale. If you've only come across one area of the work, you won't realise that 112 people have been involved in the local response in some way. And that's not including the local shops and businesses who have adapted and have gone way above and beyond. That doesn't include the medical centre, who have completely adapted how they do things. It includes lots of people who've gone out of their way to meet the needs of those, of each other, actually. We've all benefited from this. There are currently 98 active volunteers helping out in their spare time to meet the needs across prescriptions, food, check-in and chat, cleaning the food bank, little tasks like that are really not little at all. They're keeping us really safe. Delivery drivers, administrators, IT gurus, coordinators, craft pack makers, book putter-outers. It kind of, the list is endless. 98 people are supporting this community, just for starters, as well as all the others I've mentioned. And so I hope what we take with us is that feeling that whatever comes in future, long after this particular crisis passes, that people will know that there is somewhere to go for help. And my hope is that people won't leave it till they are in personal crisis before they reach out. And whether it be food and finance, medical and mental health, loneliness and vulnerability, that they will kind of preemptively know there is always someone there that will walk with them through that and help out where possible. I hope that will be part of who we are as a community.
Yeah, I think everybody echoes that sentiment and wishes that for the future too. Andy, would you like to?
Yeah,
that?
I think in the town council, we've spent quite a lot of energy and effort building up resources for young people in the town. And the last couple of years, we've been trying to figure out what we need to do to support older people, and we've made some inroads into that. But it's now become a huge part of what's going on. The support for isolated and older people is just a massive part of what the team's doing right now, and I would like to do whatever I can in the council to continue that beyond, as I said, beyond the end of this crisis, and put in whatever resources we can, because we've got this fantastic sense of community now. The connections that have been built are amazing, and it's a shame it's taken a crisis like this to make it happen. It's a bit like the war, isn't it? But maybe it's because we all get a fresh look at our priorities, and and also get some of us have had more time than we normally do. But I really want to try and keep that going as long as we possibly can, and make this town, one of the most caring and supportive towns in the country, which I think we are. I can't say how amazing it's been to have the privilege of working on this project with the team that we've had. I've been saying for years, plugging away for years, telling people how rewarding it is to do volunteer work, because you can choose what you want to do. You can do something meaningful. You can do it with a team of people. For me in particular, I work on my own on pretty meaningless stuff in my day job. So it's incredibly rewarding to be part of something like this, where I get to work with some fantastic people and feel like what I'm doing is just making all the difference. And I'm sure that's a feeling that all of the people involved have shared. And I cannot thank everybody involved enough. I think we've done an absolutely phenomenal job, and it's been a privilege to work with everybody.
And I think I'd just like to add that it's really important to remember that all this work has gone towards actually saving people's lives. It's that critical. Sefton Payne wants to add his voice to what you've all been saying, and saying basically, well done guys. Gordon White says, brilliant community, one of the best. Sammy Rees, I think we'll end on Sammy's comment. Thank you all for tonight. For the first time since lockdown, I feel I've had a social evening. So on that note, I would just like to thank everybody for taking part tonight. Our panel has been Suzy Williamson, Mayor Andy Stokes, Rev Laura McAdam, and Dr. Ian Hodgins. Don't forget to hashtag BBQT to continue the discussion. Check the government's advice on gov.uk/coronavirus. But for now, it just remains for me to say many thanks for joining us again tonight and for watching our second Buckfastleigh Question Time Live. And if you want to hear from us again, please let us know and we'll do another one. Thank you and good night.